Hello and welcome back to the channel. This past 1 to 2 months have been really crazy and it has been really busy in the hospitals and things like that. As you know, the COVID cases are increasing day by day. Right now, it's I think 3 lakh plus, but the medical healthcare and facilities and every health worker is going through a hard time. So I didn't get the time to upload the video of this pathology checklist as well. But I'm doing it today as I got some little time for myself. So without wasting any time, let's get started. What I have done in this is I have divided these things according to the systemic pathology chapters, as you know in systemic pathology what they are. So the thing is I have divided it into vascular, CVS, respiratory, which also includes the occupational, of course, genetics, CNS, hematology, a few which do not fall exactly under anything and you must know them, so there they are, and GIT, of course. So vascular systemic pathology, you need to know about atherosclerosis, aortic dissection, polyarteritis nodosa, Kawasaki, Burgess, and HSP. These are the must know. You have to know them. Next is vascular tumors, which you have to know Kaposi sarcoma. Kaposi sarcoma has been asked so many times that I don't even know, like since 4 or 5 years. I don't know how many times they have asked them, but they can ask them again. So be prepared for them. Hemangioma and angiosarcomas. For heart, you need to know myocardial infarction, which also would be included in your medicine. You have to know everything about MI is a very important topic, and so is rheumatic fever and RHD. Rheumatic fever and RHD is must know topic. They always ask you something about them, and the most important things will be the Jones criteria and the cells involved, like the cells you can see in the microscopy. The next thing would be infective endocarditis and all three types of cardiomyopathy. You better make a difference table so that would be easier to remember, and compare and contrast always makes you remember them for longer time. Respiratory system pathology, ARDS, of course, emphysema, chronic bronchitis. These emphysema and chronic bronchitis, they always ask you pink puffers and blue bloaters, bronchiectasis, cartagenars, and sarcoidosis. Occupational lung disease is also included in your PSM and medicine, especially in PSM. So you need to focus on anthracosis, silicosis, asbestosis. These two, bagasosis and bicyanosis, always get confused, so don't get confused in them. And sidrosis is also important. They tend to ask them as well. Tumors of lung all are of high value and you must know, but if I have to choose two tumors which I cannot skip out, then they will be SCC and adenocarcinoma of lung, of course. Must know lung infections will be TB and pneumonia. We were doing the integrated TB video on my channel as well. I have done half. I have divided it into two parts, out of which half of it is already been uploaded, but half of it I didn't get the time to upload. I'm extremely sorry for that. I have been trying really hard to take time out in collecting the material and then making it and then editing. It takes a lot of time, so if any of you are disappointed because of that, I apologize from my side, but I hope you understand my condition as well, because these days the timing and the condition of the country is not so good, and even I don't feel so good in my throat. I don't know, it's nothing, but I don't know, everyone's scared, so am I. Okay, moving on. So TB and pneumonia, these are the two things you cannot miss before going to your Fmge exam. You have to know them. Please know them thoroughly. Important points. Please watch the video if you have time, what we have done of the integrating the TB subjects part 1. And if you don't have time to do anything else, at least watch these two topics. Next is genetics. Genetics is of course very important. They always ask one question every year. There is one question every year, and it does fall into pediatrics as well, and medicine. Pediatrics, like these things are like integrated stuff and they fall under many subjects. So I have told this before too, that whatever topics or whatever diseases or whatever things that clash, like they overlap in different subjects, they have higher chances of being asked. So make a mental note of those things as well. Patau, Edwards, Klinefelters, and Downs is the most important ones, as you all know. I'm so sure as a medical student you all know this one. Trinucleotide repeat expansion diseases we already discussed in while we were discussing the biochemistry checklist, I think. So there I discussed the little mnemonic we have: Hunt, my fragile friend, and Huntington's, myotonic, fragile X, and Friedrichs is there. So you have to know this, and you have to know what trinucleotide repeat expansion is the problem there. In CNS systemic is what you need to know is hydrocephalus, congenital CNS anomaly, neural tube defects. Neural tube defects is always the most important favorite thing of the examiners. They tend to ask these questions. Meningocele and meningomyelocele, you need to know the difference because they might confuse you in between these two. Arnold Chiari and Dandy Walker is two which we tend to forget and which we tend to miss out while reading these CNS cases. But please make sure that you know this because these upper things have been asked many times, and Arnold Chiari and Dandy Walker have high potential of being asked. And Alzheimer's, of course, you can't miss Alzheimer's and go to exam, right? So CNS tumors, which want you to know, there are many actually, but what these are the most important, which I think, and which they used to ask most probably in other exams as well. Like there is a pattern. If they ask the question a certain topic in NEET PG many times, then there are high chances of the same topic being asked in Fmge as well. The question will not be that much twisted, but the topics tend to fall like similar in a way, if you know what I mean. So pilocytic astrocytoma, meningioma, medulloblastoma, schwannoma, and VHL. These are must know from the CNS tumors. You cannot ignore them. At least know 4 lines from them, 4 most important lines from them. Just write, just make a short note of these topics. Write 4 most important things of each topic, and at least remember those. Hematology is very important in pathology. They tend to ask a lot of image-based questions. So if I would be you, I would not miss on the hematological images or microscopic images because there are gonna be some of them in your June 2020 exam as well, for sure. So Hodgkin's lymphoma, G6PD deficiency, sickle cell anemia specifically, and especially all anemias. Basically, all anemias are very important. And hemophilia A, B, and C. Basically A and B. C is also included in some of the textbooks, and it is because of the deficiency of factor 11. So it's better if you know these things. Also know hypersensitivity reaction diseases. The classification is there: class 1, class 2, class 3, class 4. The examples inside those you need to remember. Types of shock, obviously the 4 things: cardiogenic, hypovolemic, neurogenic, and these things. And the blood bank questions, like the exams are moving more towards the, how to say, the practical aspect of the things. So blood banks, the agents used to store those blood components and the shelf life of different components, and those kind of things have become really important these days. So please go on and watch some YouTube video on blood bank and blood storage things, or whatever app you have. Go and watch the video or notes through this. These are, you cannot miss blood bank because most probably there might be one question and you don't want to miss it, and it's not that difficult. If you have read it once or twice, you would be able to answer. They cannot twist it in any other way that you missed the answer or something like that. So GIT I haven't covered in this one. The cases from GIT almost are the same as the cases we would be discussing in surgery, so I'm keeping it for the surgery checklist. I will try to get to release those GI surgery video as soon as I can. These days I have been hard. So yeah, let's do GI systemic pathology in surgery. We could make it up with surgery. That is almost the same. So thank you so much for having the attention span, and have a good study hour. All the best. Good luck for the future and study well.